Hello everyone, I hope you are doing well. Today I will discuss a common problem mainly affecting middle-aged men over 50 years old. Of course, it can also affect a younger man, but it is more common from 60, 65 or 70 years old. This concerns benign prostatic hyperplasia. I am not a specialist, but I have enough knowledge on this subject to share with you. What is benign prostatic hyperplasia? As the name indicates, it is a prostate that enlarges. Normally, the prostate has a certain size. It is a gland that helps produce semen. In fact, over 99% of the semen's sperm volume is produced by the prostate. This gland surrounds the urethra. The urethra is a small tube through which we urinate and through which sperm pass and fill with the prostate's contents. When this small gland enlarges, it sometimes becomes less round, less uniform, and then it presses on the urethra, the tube through which we urinate. So what is the problem? Often it is not well diagnosed initially. The symptoms usually appear when urinating with a weaker stream. Already there is less force. That is an early warning sign. People urinate and think, oh, it's weaker. Then sometimes when they urinate, they feel the urge but have to wait before it starts. Of course, since it presses on the urethra, the tube through which we urinate, they have to wait. This can be bothersome and cause a loss of time. Sometimes after finishing urinating, a few drops remain. These are also signs. Some may experience irritation of the urethra, which can cause night awakenings, maybe 2, 3 or 4 times to urinate, whereas before they did not have this issue. This can be a symptom. It could be a symptom of something else, but generally these are the signs we notice. Sometimes it may be accompanied or not by erectile dysfunction, meaning an inability to maintain an erection sufficient for intercourse, that is, how to say, acceptable for both partners. So now, once we have identified the most common symptoms, is it serious? No. Is it bothersome? Of course, yes, it can be, but not too much. And now we need to know when to treat it. If it is not very bothersome, of course, you should have it checked by your primary care doctor and urologist, do an ultrasound of the prostate, a clinical examination, and possibly an MRI of the prostate. Discuss this with your doctor. Then, if there is nothing particular besides hyperplasia, the volume should be measured to compare over time, and PSA levels should be checked through blood tests to have reference points year by year to monitor progression. If the hyperplasia is very mild, phytotherapy, plant-based treatments can be effective. There are many different herbal treatments that can work well. Honestly, they are not very strong, but may suffice initially. When it becomes too bothersome or more troublesome, medication is necessary. One well-known medication is tamsulosin. There are others. Sometimes tamsulosin is combined with another treatment, which is a bit stronger. This can be enough. And if it is sufficient, that's good. You can take it just for comfort, let's say. However, if it is still not enough, you should see a urologist who might suggest TURP, which is transurethral resection of the prostate. There are probably 2 techniques nowadays, but basically they scrape the prostate to reduce its size and free the urethra a bit, which is not without side effects or possible risks, even if the success rate is quite good. You should know the advantages and disadvantages, which is best discussed with a urologist who can explain it much better than I can. But basically, these are the options available to you. I hope this has at least reassured you and been somewhat helpful. Let me know in the comments if you have questions or video suggestions. Thank you. Good evening. Goodbye.